welcome back to the Integrative Health Podcast with Dr. Jen. We're going to be diving into natural cancer solutions today with Dr. Michael Karlfeldt. He's an ND and a PhD. He's been in clinical practice since 1987 and runs a busy integrative medicine cancer center, the Karlfeldt Center in Boise, Idaho. Him and his staff provide themselves in being compassionate cancer warriors, focusing on cutting-edge integrative cancer therapies and working with international leaders to provide metabolic, genetic, and nutritional solutions to cancer while triggering cancer cell death through targeted oxidation. His drive to investigate and implement effective, restorative, and safe cancer therapies was fueled by losing his father to colon cancer in his 20s. His passion to promote natural health publicly has led him to be a sought-after lecturer, writer, and educator. He was the host of the Dr. Michael Show, which aired 100 episodes discussing important health-related topics, reaching about 1 million viewers. Currently, he hosts the TV show True Health, Mind, Body, Spirit, available on Amazon Prime for many years and now airing on Tubi TV. Never heard of that.
TV, yeah.
He's also the host of the radio show Made Health Radio, where he connects international leaders in the integrative health arena. So he has done so many things. He has a book out. We're going to talk about it all today. And he has 2 podcasts and launching another one. So welcome, Dr. Karlfeldt. We're so excited for your expertise.
Well, thank you so much for having me, Dr. Jan. This is going to be so fun.
Yes, it will. I mean, you're all over the place, and this is amazing because it's your passion. Can you tell us a little bit about what happened in your 20s with your dad, and if you were even thinking about doing medicine before that happened?
Well, I was actually in naturopathic medicine at that time. And my father and I, he was German, and we weren't very close. I grew up with my mom, and I actually did not find out about his passing until about 6 months later. Yeah, that's what. So what happened essentially is that I find out about his passing, and here I know all these different tools that are available, and then I hear the stories of what he goes through. I hear he's this big German man, and he's just kind of wilting away to nothing, and he just becomes a victim of just a normal traditional oncology. Not saying that that is all bad, but there's so many other tools out there now, and he wasn't given that choice or that opportunity to be looking at additional things that are there. So that experience, knowing that people are just going down a treadmill essentially, where or conveyor belt, I should say, where they get diagnosed and then poop, they just get pumped in, put into the system, and they really don't have a lot of, the oncologist pretty much just tells them this is what you're going to do, and they really don't have a lot of options or choices. And sometimes, the oncologists give people the illusion that they are going to give them a curative therapy when the oncologist knows that there's going to be, like palliative care, where they're happy just to extend life. But the people that are diagnosed, they think that that gets a curative measure. So my passion was then to go on a quest and find what are some of the most powerful therapies out there. What can we do to change this scenario that my father went through? And then also seeing then kind of in my early days working with patients that they are really people dealing with cancer, they're looking for something more because they see that what's available is just not cutting it right now. It's very very few options out there. So that's what's fueled my passion, seeing the hopelessness and seeing the lack of options. And not saying that we, with what I do and what other people do, that we figured out completely to cure all cancer. We haven't. It's still a journey. It's a very complex disease, and understanding that and recognizing that there are a lot of things that can be done to optimize the outcome.
Yeah, absolutely. And I'm sorry that happened to your dad. That That would be very hard to hear in your 20s. And one thing I'm sure after your dad's diagnosis, when we talk about cancer, we talk about fear, right? And you like to say you don't have to fear cancer. And I would love for you to dive into that a little bit more because like you were saying, this conveyor belt, it's almost like when people hear they get cancer, they know that they're going to be on that conveyor belt and waste away and get chemo and feel like crap, and then that cancer is going to come back, and doctors actually tell them that too. And it's this fear in conventional medicine that, it happens so much, like if you don't do this, then this is going to happen. And fear is not good for recovery. So could you go a little bit into why people should not fear cancer?
Yeah, and that's the thing. You hear the word cancer, and you immediately think that this is end of life. Yeah, and this is I mean, it is a deadly disease, but we're actually coming to the point, and this is actually being discussed, among a lot of scientists and doctors. Uh, it is that we have a lot of people out there that are living, post-cancer care. Yeah, it's a huge percentage out there. So it's becoming more and more common that you're diagnosed, and now you have a lot of people out there living normal, healthy lives, and they dealt with cancer in the past. And so the thing with cancer is that, since we have so many options and there are so many solutions, there are, and I see it in my practice, and I know colleagues see it in their practices. There are patients that are diagnosed with the most horrific things, and now 20 years, 30 years later, they're still doing great. So there's no reason to fear, because, and I see, yes, the traditional oncology, they have evolved some, but essentially, it is very similar tools that they're using. They are just dialing in the dosages, they're dialing in, so that they don't. It's always kind of finding in traditional oncology, finding that space in between. How much can we pour onto the patient so they don't die, but still, shrink the tumors and kill the tumors, as much as possible. And so they've gotten better at dialing in, how much of toxins, so to say, to pour onto patients. Uh, but they haven't really gained a huge amount of additional tools. A little bit of the immunotherapy that they're still working on. Obviously, get the hormone therapy has been around for a while, but other than that, it's still just kind of cut, burn, and poison. Uh, so, and again, not saying that those tools are not important. They can be very, very useful, but then uh, pairing that together with a lot of things of the integrative care, like the high dose vitamin C, like, what to eat, and looking more at the different drivers of the cancer, looking at the root causes, looking at the terrain, looking at all these other things. Also looking at trauma, trauma and stress. I don't know how many times I have patients, when they're diagnosed, and I see them for the first time, and I ask them, why do you think you got cancer? And I would say probably about 8 out of 10, stress or trauma are big factors. So we see then kind of the emotional aspect of it becomes such a big factor to look at, and then also in our daily life to be able to mitigate, the stressors that we're dealing with, and so forth. So uh, knowing that you have all these areas that you can do something about, that you can address, and addressing them appropriately, I see amazing outcomes. There's so many cool stories out there for people. So that's why there's no reason we have the diagnosis. Don't fear, because there's so much that can be done. And the mindset of fear, actually, sad to say, it suppresses the immune system, promotes inflammation, and it also turns down your ability to heal and regenerate and detoxify. So you actually put yourself in more at risk, when you are dealing with fear, rather than knowing that I got this. There are tools out there, which there are, and we can beat this.
Yeah, that's amazing. And that's not what people are hearing out there. They're hearing that there's only one choice. And I always like to say, like, you can't have cancer or disease without inflammation. So let's talk about inflammation, um, and putting out that fire, because if you want to prevent cancer, you need to be controlling your inflammation and those external factors. And if you have cancer or in remission, you also need to be working on that.
Yeah, and there really is no cancer without inflammation. Yeah, so inflammation always is the fuel that drives that process. In fact, cancer uses a lot of the inflammatory drivers for its own promotion. Yeah, so we if we are dealing with inflammation, I mean, a majority of us are, so it's just kind of at the level of, inflammation, then it's important to assess and see what is promoting the inflammation in my body and what are those things. And then we have, diet, we have, what are we exposed to, toxin chemicals, what are some of the pathogens that are there, our emotional mindset we talked about, is that driving inflammation? So all of these things need to be looked at, in order to mitigate the amount of inflammation. So whether you have cancer or not have cancer, inflammation is a big, big deal to look at. And it has been said, and I've repeated many times, that cancer is a wound that never heals. Yeah, so, and we know inflammation is what drives a healing process. So we have an injury to a joint or a tissue, and inflammation is triggered to that tissue for immune system to get to that location and to heal that tissue. Yeah, so, but what if the inflammation, if we can't get rid of the things that are aggravating the tissue, or we don't have the nutrients that we need to complete that healing cycle? So now we have tissue that is in that chronic state of inflammation. And when you have that, that is what then promotes these cancer processes, that creates a microenvironment that then later on starts to turn into like a microtumor environment, where, the tissue is trying to figure out how to survive, because we are not given the resources that we need in order to be able to heal itself. And it shifts then into more of a survival mechanism, that then promotes inflammation more because it produces inflammatory substances like lactate, to support, kind of a process of cellular behavior that's different than normal, just because of that chronic inflammation that's not quenched.
Right. And this can be confusing, right? I've had cancer patients that were told that they should just eat all processed food because it's easier to digest. So this is very lost. So you mentioned trauma as like a cancer driver. What about different pathogens, toxins? Where do they play a role?
Yeah, so we're looking then at, we kind of go deep on a cellular level in cancer. What are the changes that are taking place in a cell that makes it move into kind of a cancer behavior? And frequently that is when the mitochondria becomes dysfunctional. And the mitochondria is like the energy factor within the cell. And when that is not functioning appropriately, then the cell then is not able to do all the different functions that it needs to do. So then we have to think, well, what is interfering with that mitochondrial activity or the energy production? And so, toxins are that, pathogens are that, so toxins are the different chemicals, heavy metals. So then we need to look at, are we able to drain the body from these different, toxins, that are then interfering with the energy production with the cell? And if we're not able to move those out, and obviously the best is if we don't get them in to start with, but we live in a toxic world, so there's only so much we control. But if we're not able to move that out, they start to then build up within the cell and then interfering with the energy machinery of the cell. And the cell then start to kind of recognize that I cannot survive, doing this the way that I'm producing energy. So it then shifts to a different way to then produce energy using then what's called a fermentation process, where it ferments the sugar rather than using oxygen to drive the energy production. And that fermentation process, so it's actually that the mitochondria will shift how the genes, which genes are turned on or turned off, because it's lacking energy, and it creates that those changes in the DNA just for its own survival. So it's a kind of a hardwired survival mechanism, because the cell is under distress or under a circumstance that is very hard for it to survive. So then it needs to go into more of a primal behavior.
Yes. And kind of along that, not a lot of people might understand what cancer stem cells mean, and how that plays a role. And do you think that conventional medicine is even taking care of that? And probably that's why cancer returns. Can you explain a little bit more on that?
Yeah, so going back to kind of the statement that cancer is the wound that never heal. And we know we do have stem cells, and stem cells are used then to regenerate tissue. Stem cells can become any kind of tissue. It can become a kidney, can become a liver, can become whatever. And so, but it's the same, it functions the same with cancer tissue. They have their own stem cells as well. So when the cancer tissue is injured, then the cancer stem cells are activated to help to heal that tissue. And so whenever we then blast a tumor, we're creating injury onto that tissue, which will then activate the cancer stem cells. So that's the biggest challenge in traditional oncology, is to control these stem cells, because yes, you shrink the tumor, and yes, it looks like now I have no evidence of disease, but the smoldering fire are the cancer stem cells that are kind of waiting for, now the assault is over. So now we can kick into hyperdrive, because we really really need to upregulate the healing of this tissue, of this cancer tissue, because it's been so assaulted. So in traditional oncology, there's really no solution, to cancer stem cells. All the therapies, whether it's surgery, radiation, chemo, all of those therapies upregulate the function of the cancer stem cells. So that's why it's so dangerous in my mind to just rely on those therapies and not identify the other risk factors that we need to address. So we have the two things. One, why is the cancer there? If we never address the initial driver, the initial factors, root causes, then whatever caused it to be there, that cause is still going to be there whether we get rid of a tumor or not. And that's still going to keep on driving that process of producing cancer. Then secondly is, now we're using traditional oncology, we're blasting the tumors, and what about the cancer stem cells? How do we calm those down? And that's a beauty when you step into the integrative care, where we're using things like vitamin C, like ozone, like curcumin, like EGCG, like CBD, there's so many tools out there, and they are known to calm down the activity of the cancer stem cells. And so we talked a little bit about inflammation. The inflammation is also what kind of drives the activity of the stem cells. So if we can calm that down and we can control the environment, and yes, sometimes we need to control the tumor, but recognizing that cancer is so much more than just a tumor. It is a whole body event. It is a systemic, so you got to look at the whole individual, and you got to look at all the factors, and just becoming myopic, looking at the tumor, thinking that just because it's shrinking or growing, now that means either success or failure. There's so much else going on in the body.
Yeah, and that's the problem with conventional medicine is it's so compartmentalized, right? You have an eye problem, you go to the eye doctor, your stomach hurts, you know, you go to the GI doctor, but it's all connected. And, you know, and it's very frustrating. You know, breast cancer, for example, no one's even looking at their estrogen detox pathways. So they're just killing the cancer or doing whatever, doing mastectomies, double mastectomies, but they still have that problem where they're not detoxifying estrogens well. Maybe it's mold blocking, you know, the function of their liver. Maybe their liver, they're just genetically slower at processing estrogen and it's going down the bad detox pathway. So it's very frustrating because I think patients need to be empowered more, you know, to know that they can change their epigenetics, they can change their cancer risk, you know. How do you approach that with patients? I mean, most patients you're getting are pretty motivated though to make those changes, correct?
Yeah, and that's the reason we're doing these things, you know, where we're communicating and we're reaching people so that they can understand the that they can put themselves into the driver's seat. Because a lot of people, when they hear the word, you know, cancer, they immediately feel hopeless, and then they, you know, put themselves in the passenger seat, and then, you know, they feel an expert should kind of take their body and do whatever they need to do with the body and fix it. So in reality, what we see, and studies have shown this, that when an individual is in charge, when they take control of their situation, they have a much better outcome than somebody that just becomes passive and let things just be done to them, so to say. So it is really important to recognize that you as an individual, you have the best doctor, you know, on your side, and your best doctor is your body. Yeah, so if we can support that innate healing intelligence that exists within you and recognize that cancer is just more of a cry that there's something wrong, you know, the body has been trying to communicate to you that maybe you're sacrificing, you're not living your own life, you know, you're doing everything for everybody else, and you don't put yourself as an important individual. Or maybe, you know, there's some, or like you're talking about, maybe there's just mold that's just not being rectified, or maybe they're hidden dental infections, or maybe, you know, you're a hairdresser and you're exposed to chemicals all day long and it just builds up. And, you know, so all these different things are bodies and cry that there's something wrong and something needs to be fixed. And, you know, kind of the last final scream that the body's doing is to produce cancer. So if we recognize that cancer is just body's way of communicating, and that we should then start to listen and see, you know, why is the body's feeling like it needs to scream this loud, then we can then start to do an investigation and see, what do I need to change, you know, to have a different outcome? You know, what does my life need to look like, so that I can be filled with joy, with peace, with energy, fulfillment, purpose, etc. What does that need to look like? And then, you know, take charge of your own life, and then, you know, recognizing that, you know, I cannot just, and it's important to understand for people that, you know, when you look in the animal world, you know, we all seen animals that pass on, you know, at an old age, and then you find out that they have a bunch of tumors, you know, elsewhere. So they never died from tumors, and tumors a lot of times are not deadly in themselves. You know, so if we give us the time to start to respond uh, when we have the diagnosis, and then look upon the body as a whole, address that, look upon all the different factors, you know, then we can then have a different outcome. We don't have to fear cancer, and we can heal.
Yes, I love that. Now, you brought up tumors. Is there any danger to biopsying the tumor? I think there was a video going around on social media about, you know, if you biopsy and you pull out the needle, you're spreading the cancer cells. And I've had people ask me, and I'm like, I don't know. Like, I don't know. So I'll ask you.
So I can, and there's a lot to that, so and I've seen many times, you have a woman with a breast tumor, and they do the biopsy, and right after the biopsy, it just explodes. It just becomes, something extremely hideous and bleeding and look like big cauliflowers. Uh, so there is something to that, and the way I like to explain it is that cancer becomes like body's attempt to accumulate everything it doesn't want in one location. So it took a lot of effort for the body to bring all the junk from all pieces of the body and then put it in one location and then put a wall around that, to make sure that that's in one location rather than aggravating the body all over the place. So when you then put a needle into that, now you are essentially it's like a prison break in a way. You have a prison, you have walls, and you contain all the people you don't want in society in one location. And now you just blew a hole in that wall, and all the prisoners are going to say, "Yippee! I'm going to run out, out to society and do what they did, before." And you know, so it took a lot of effort for for society to move those people into the prison. You have the police, you have judges, you have all attorneys, you have all this energy that took place. It's the same in the body, that it took a huge amount of energy for the body then to put everything in there. So we shouldn't really focus so much on the tumor. And if we don't have to do a biopsy, uh, in my mind, it is better, if we can. I mean, at some point, yes, it's better to, there can be some benefit of knowing what it is. But when you do that, if you do that, it is really important that you support the body as a whole. You really support the immune system. So it's kind of like, again, going back to the prison break. If you're going to blow a hole onto one of the walls, then make sure you have a huge amount of police force there, that you have all these reinforcements, so it doesn't just leak all over the place without any kind of control. So if you're going to do that, then make sure you support the body with different mushrooms, with beta glucan, with immune boosting things, making sure that you minimize the toxins in the body, open up your eliminatory pathways, that you bring in things like high dose vitamin C IVs pre and post, and ozone and all. So there's so many things that can be done while doing the biopsy. So the biopsy is just something that it is not something that is just an innocent thing to do. It has a huge impact on the body. And if we're going to do it, we got to be prepared. And that's why it's so important to contact somebody like myself, and people like me, to support the body pre-biopsy and pre-surgery. And so, yeah, biopsy is a big deal.
Yeah, and I think it's really interesting. So I went through like a cancer scare when I was in medical school. I had a nodule on my thyroid. They had biopsied it, but the biopsies are like inconclusive. But they let me go a couple years, and then it got bigger, and they're like, you need surgery to rule this out, conclusively, right? And they take they takes that nodule out, and they do a frozen biopsy while I'm in surgery, sleeping, under anesthesia. And that's why the surgery is so long. And if it's cancer, then they take out all of it, right? And it's just interesting because it's like, like you said, they're going in there, they're disrupting everything, and then they get the results back. And then they're like, oh, yeah, it's cancer. We need the whole lump out. It's just so interesting, like breast cancer specifically, like how it's managed for women. It's very frustrating. But yeah, I mean, praise God, I did not have cancer. I had Hashimoto's, which was mismanaged by conventional medicine. But the big thing is, if you're listening out there and a loved one, your parents, like whatever, they're going through this, and they found a lump. I've had to tell so many people that in the emergency room, like, oh, the CT scan, this isn't why you're having abdominal pain, but we saw this incidental finding of a tumor, a growth. So when you're going through it, yes, it feels rushed. Yes, it feels scary, but make sure you're lining up your dream team so you can manage it properly with herbs and botanicals and things that are going to support your body when you're going through these different surgical and medical processes. So as Dr. Karlfeldt said, you're not on this conveyor belt of madness of conventional medicine.
And it's also, that tumor, that lump that was found, a lot of times it didn't just come about, within the last month. This is something that has evolved over a long period of time. And so knowing that, whether you take an additional month, 2 months, 3 months maybe, to really kind of feel out, how do I want to address this? Who do I want to be? Who do I want to have on in my court? What should my dream team, like I said, look like? Uh, so taking a pause, breathing, and meditating and praying and kind of feeling out what feels right to me, rather than just kind of, oh, there's a lump, and now you have the Three Stooges, that are all, everything, sky's falling, and we got to do something like immediately, otherwise we're gonna die in 2 months. That's not the case. I mean, there are some rare cases that you really have to be aggressive immediately, but they're few and far in between. So just knowing that you have the time, and that lump, it's not really the lump in itself that kills you. It is when that starts to kind of move into other locations. So yes, if the lump is encapsulated, the rest of the body is doing good, then we want to see why is it there, and then we address that. And then if we feel we really need to do the biopsy, then make sure that you are then supported, and so that it doesn't go elsewhere, because again, just a lump in itself doesn't kill you, but it's when these things start to move into other locations, that's when it becomes more challenging. So the less we do to disrupt that environment that the body's worked hard to create, creating that lump and isolating that, the better, in my mind.
Yeah, absolutely. So let's talk about some cutting edge cancer treatments that most doctors don't know about and they're not initiated. Could you talk about some of your favorites?
Well, one of my favorites, which people come to me from a little bit all over the world, is photodynamic therapy, and I love that just because, to me, we are, in my mind, we're bodies of light. We're frequency, we're energy. And so a lot of times when we are dealing with diseases, is because our energy is lower, our frequency is not, what it needs to be. And light is such a kind of early foundational principle that we all need. And so photodynamic therapy, essentially what that is that you combine a laser light, intravenous, external, interstitial, where you can bring it to the tumor, with a photosensitizer that have a preference to accumulate then in tumor tissue. And so because it accumulates in the tumor tissue, when you expose that tumor tissue then to light, it triggers a higher concentration of that energy into that cancer cell, and it has a hard time then to handle the production of the different reactive oxygen species, or these oxidative or stressful components that accumulates in the cell when you then activate those photosensitizers using then laser light. So it becomes a very targeted and non-invasive, non-harmful type of therapy that really goes after the tumor. And then the light in itself on healthy tissue, it has the ability then to actually support mitochondrial activity. So it's actually restorative, regenerative. And when you do this intravenously as well, which we do here at our center, then we're talking about cancer stem cells, circulating tumor cells. They are passing by in the bloodstream. So when we do, the photosensitizer will attach itself to them, and then when we then expose them to light, as we have the optic needle, intravenous, and treating the blood as it's passing by, these cancer cells or these cancer tumor cells then are then oxidized. And what happens then is that then you have these components of the tumor cells, that are then broken up, and the immune system can then check these things out and then produce the appropriate immune response, because now it is in a calm environment where the immune system is being presented by all the different details of these cancer cells, what they look like. So it's kind of like a vaccine effect in a way, that is being created, and then the immune system produce the antibodies, produce so they know who the enemy is. I kind of, it's kind of, isn't it, wouldn't it be nice, for, let's say you have Russia and United States and they're fighting each other and they trying to figure out each other's secrets. If, somebody just came and presented the CIA or, whoever it is, here, look, here are all the Russia secrets. This is all, they have their, bombs are going to be dropped there. They have these, pointed at us over there, and everything. And that's kind of exactly what happens when you present these cancer tumor cells to the immune system using something like photodynamic therapy. So that's one of the therapies I love. There are other amazing, you look at looking at it from a metabolic aspect. So we know that cancer is it thrives on glucose, thrives on sugar, because it shifts that way of producing energy. So looking at it from a metabolic point of view becomes really powerful as well. So you can use then diet, you can use also intravenous substances like poly-MVA, DCA is a combination that I like a lot, because it blocks then the how the cancer cells produce energy, and then pushes energy through the mitochondria or the energy factory. And what we know is that the mitochondria holds the cell death switch. So when that is dysfunctional, then it is not able to trigger that cell death switch. That's one of the ways that cancer becomes immortal. So if we start to push then energy through the mitochondria in the cancer cells, then that promotes then that cell's ability to say, this is dysfunctional cell, let's kill it off. So there's a lot of more understanding that's coming out there. And another therapy that I love that we use is using substances, and from if you do biopsy, but then if you don't, you can also use blood and urine, and then collect information about the tumor, the cancer that's in the individual, and create a very specific peptide blend that is targeted to correct the signaling, the immune system signaling, so it does not support cancer activity, and that it is promoting then the appropriate immune system response. So it becomes more of an intelligent immunotherapy, instead of just kind of upregulating everything that we do with immunotherapy that's available now. We're upregulating the areas that need to be to go after the cancer, and downregulates the areas that are too active, that may be promoting cancer activity within the immune system. So those are just a few. I mean, there's so many more, but that would take a whole workshop. Yeah.
I know. Or, people can get your book too. But I Weber lasers, I got IV light therapy in December at A4M, and it was so cool. It was so cool. No one offers it around where I'm at. So it's awesome you guys have it. One last question. What are your thoughts on low dose chemotherapy? And do you ever, how do you work with patients with that, and your thoughts on chemotherapy?
Yeah, so sometimes you can do low dose chemotherapy to have that effect, like I talked about. You kill a little bit of the cancer stem cell or cancer cells, and the body will then see that debris, and then the immune system can respond to that. So it almost becomes like you're upregulating the immune system against what was killed, but you don't do so much chemo that you're completely destroying the immune system. So it plays a really good role. It's still not something that I would jump into immediately. I rather, if we have the time to do other things rather than throw chemo at it immediately, I would rather do that. It is, in my mind, a much more intelligent way of doing chemo. And you can combine that with, like fasting around the chemo to really increase the delivery of it. There are also, new research that's coming out that's really fascinating. We've done a little bit of that here as well. And that's using nanoparticles, like the platelets. Yeah, so using actual platelets, as a delivery mechanism of the chemo, to get that more into the tumor. Because what people don't understand is that when you get chemo, very little of that actually ends up in the tumor. Maybe 5% gets there. The rest of the 95 is all over the body. So if you can use lower dose, or you can use a better delivery mechanism, or use ways to increase the concentration in the tumor, you're that much better off.
Yeah. Yeah. And that's, it's just, that is where patients come to me with the most questions. And I, refer them out to someone like you, because it's very individualized, and it depends on the type of cancer too. It's difficult.
Yeah. No, it's a complex scenario, and it's something that you need to look at the whole picture. You can't just get tumor focused.
Yes, I love that. Can't just get tumor focused. That's great. Well, thank you so much, Dr. Karlfeldt, for being here, sharing your expertise. And can you tell everyone listening a little bit of how they could work with you, how they could get more information on what you do in your team, and where they can find your book, your podcasts, all of the things?
Yeah, so first, you can go to my website. There's a huge amount of information there, a lot of blogs, a lot of, so in essence, whatever you type in, if you type in the word cancer, I mean, the amount of information you get, it'll keep you busy for a year at least. So there's a huge amount of information on my website, and you can find it at thekarlfeldtcenter.com. I have a podcast called Integrative Cancer Solution with Dr. Karlfeldt. It's available on Spotify, iTunes, Google Play, all the different platforms. Also, my book, A Better Way to Treat Cancer, it's available on Amazon. It's a 500-page, and it's not just for people battling cancer. It's something that everyone should have, because it's tools on what you need to do to mitigate the risk as much as possible. And we do, if there's an individual out there battling cancer and needs more clarification on what to do, we do offer a free 15-minute discovery call. So you can just give our center a call at 208-338-8902 and schedule a discovery call, and we can chat a little bit and see what's going on, and see how we can help.
Awesome. Well, thank you so much for being here. And I just love that discussion. And really, to wrap it up, like, do not fear cancer, right?
Exactly. Do not fear cancer. Just put yourself, step onto that field. Know it's your Super Bowl when you have cancer, and just know that you're the best quarterback out there. Take control, and you're going to win that game.
Oh, I love it. Well, thank you so much. We really appreciate you.
Thank you so much, Dr. Jen.